This is approximately situated at the two organs which has sacs. Sac, the organ along with a sac. In the sac, that is the heart and the pineal gland. These are the two organs which have a sac with a fluid in it, with the fluid in it. These fluid has special crystals called piezoelectric crystals. So the Agyatmaka Ojas and Somatmaka Ojas, the two interconnecting points of body and mind, are present in the heart and the pineal gland. These two glands are again different because they are sac-like structures. They have fluid which has piezoelectric crystals in them. These piezoelectric crystals serve as the antenna to process the information that is broadcasted from the mind into the body in the form of biorhythms. These biorhythms can be perceived by nadi. These biorhythms are present, it sends the signals all over the body, which can be perceived by nadi. Any lack of element or lack of mineral in the body or any change in the body change the biorhythm. At the same time, any change in mind or any disturbance or imbalance in the mind again change the biorhythm. Thus, we interpret, perceive the patterns of the biorhythms through the practice and interpret the change that has happened in the body and the mind. That is the connectiveness of our body. I mean, the way we understand the nadi. Is it clear? Yes?
Where he doing with
Ah, which gland specifically?
Pineal.
Zirbeldrüse?
No, it pituitary then pineal. It's
Yes.
there.
Zirbeldrüse? Und im Herzen. Ja.
Actually the present medical science has a very less knowledge. I mean, they are still researching on the pineal gland.
They know there are crystals in the pineal.
Yes, but its functions are
Yes, functions.
whole spectrum. But the practices which were done by rishis were majorly based on the pineal gland. The heart perceives all the human emotions. The pineal gland perceives higher emotions. It is the converting or the antenna point of higher emotions. That is the major two difference between these two. So these piezoelectric crystals change the biorhythms, and thus through nadi we can perceive these changes. We see nadi in both the hands, right hand and left hand. One hand, in a male, right hand denotes the body, left hand denotes his mind. In female, left hand denotes the body, the state of the body, and right hand denotes the state of the mind. So that is from which we understand what are the changes, what is the prakruti and all. So in body, we mainly concentrate first, we see the nadi at 7 levels. We totally see in the 7 levels. We first identify what is the prakruti of the patient, of the person, because the whole basis of the treatment is realignment of the prakruti. Thus, we first locate the base point, the base prakruti of the patient, and then along with the prakruti we understand the state of tridoshas, we can understand the state of dhatus. There are even sub levels in tridoshas which is called subdoshas, like 5 types of prana, 5 types of vata, 5 types of pitta, 5 types of kapha, which determine various functions of a body. We also understand the state of each organ. Each organ is again related to an element. Each organ has a dominating element in it. For example, liver has a domination of pitta generally, but based on your prakruti, how much dominance of pitta is needed, that is what is determined at the organ level. That can also be perceived through pulse. So these are the 4-5 factors which we basically work with the pulse. In the mind, we basically depend on trigunas, the sattva guna, rajo guna and tamo guna, which I have mentioned at the beginning of the seminar. From the trigunas comes 7 major qualities of the mind. which the Ayurveda or the yoga explains as Arishad Vargas, the 7 main emotions: Kama, Krodha, Lobha, Moha, Mada, Matsarya and Avidya. This is the basic principle on which we analyze the mind. These 3, Sattva, Rajo, Tamo gunas ratio in these 7 kinds of emotional or mind states determines the state of the mind of the patient. Generally, when in balance, it needs to be in the same pattern. As we are in as the body pattern is the same ratio of the body pattern should be in the same ratio of the mind pattern. Then it is in the alignment state. The rhythm, the rate, the pattern of the pulse, the strength of the pulse, the bala, everything should be same in both the hands. Then the body and mind are in harmony, which is 90% not possible in nowadays, of course. So that is what we see in the pulse. So we have given the brochures where we have explained clearly what we see in the body and what we see in the mind. Pulse explains us or helps us to understand the person, which even the person doesn't know about himself. Some things only we are aware of, but something in the background we also never pay attention. So that helps, that in that much depth the pulse diagnosis helps us to know about a person. That's why one of the pillars of Mahasiddha Vaidya Chikitsalayam is this pulse diagnosis. So that is about the pulse. Now I would like to proceed for the treatment. Any doubts regarding anything? Anyway, I will be taking the pulse for who all wants to take the pulse for on 21st. I would be explaining it again, but still I just wanted to know the base of what is the pulse.
Arishad Vargas, can you put it in English so that?
Kama is there is totally 7 types of Arishad Vargas. In one way, in easy way, I can say it's emotional states, 7. One is Kama, is desire, out of way. This is all the negative qualities of lust. It's not lust, sir. It's not lust. Kama is not lust. Anything desire to the excess, to that extent that you are ready to do anything for that. That is Kama. To that extent that when it is not fulfilled, that desire is not fulfilled, you get Krodha, you get anger. Krodha is the emotional state where when this is not fulfilled, you lose your balance, you lose your harmony and react. That is Krodha. That is anger in English term. It can be, again, there is, because it is not, there can be many degrees like anger, rage, again leading to hatred, and all this comes in the Krodha only. Then Lobha. Lobha is greed. To have something for ourselves is quite necessary. To want to have everything only for us is Lobha. Only I want this is Lobha. That is the state of Lobha. And then Moha. Moha is any kind of attachment. Attachment to anything beyond the control, beyond, so that you pay complete attention only to that attachment and destroy everything else. That is Moha. It can be anything. It can be physical, it can be emotional, it can be to a person, or it can be to anything. So Kama, Krodha, Lobha, Moha. Mada is one kind of pride that only I will have this. One kind of arrogance, yes. One kind of arrogance where only I have this and only I should have this. Nobody else should have this, so that my pride is maintained. That is the next degree of emotional imbalance. And finally, Matsarya. Matsarya is manipulation. Manipulating to fulfill all these things. We go up to an extent of even maybe killing somebody, or that's the higher extent of the mental state. We do not stick to anything. We just want our things to be done. So that is how we categorize the degrees on this. Again, all these 7 are the ratios or a combination of sattva, rajo, tamo gunas only. regarding the mind and body, and regarding the pulse, if we want to explain, it is complete a different class, because we need to understand each element out of it to understand what it is. So this is an outline of what we see in the pulse. Okay, so next and last, seventh is avidya, that is ignorance. Only when we are ignorant we do all these things. According to Veda, avidya is the main cause of all these 6 type of negative emotion states. If we are enlightened, or if we know what are we doing, and we with the proper knowledge or proper jnana, we can get back to ourselves. Because when we work with mind, it is 50% in the hands of the doctor and 50% in the hands of the individual. So we treat, or we help with the balance of the mind through flower remedies. That is the tool which we use, because that is the best soothing way which help to treat or overcome their trigger factors and all. So this is about the pulse diagnosis. Next, let us go with the treatment, what MSVC. Okay, this will explain the last. So whenever a patient comes to us, we see the following major things, major 6 or 7 things. We see the patient as a holistic person. We don't see it only his body, or if he says like I have this pain, we don't only concentrate on the pain. We try to understand, analyze both his body, his mind, and what is his spirit towards a positive drive. Does he have a positive drive or towards a negative drive? Next, we adapt an individualistic approach. Thus we understand the prakriti of the person and also the nature of the vikruti. Then we concentrate on the epigenetic factors, which I will be explaining in the treatment part. Epigenetic factors also play a very important role in modifying many things, in modifying health, in modifying disease, everything. We not only concentrate on the disease conditions or whenever only the imbalance, but we also help or counsel the patients to work for well-being, because there is more to do in life. With well-being body and mind, we need to attain the purpose of the life because of which we are born. So that is what we suggest. And then we support the body to heal. We do not replace or make you dependent on us. The dependency is mainly based on the mind. For example, there is whenever we get diabetes, we are prepared it's a lifelong disease. 80% of the population, they say no, it's a lifelong disease. Yes, we got a disease which we need to carry it as long as we are there. So we are indirectly putting in the mind that I accept the disease completely, which is, according to me, should not be there. Or whenever it's a cancer, it's a life-threatening disease. We accepted it. Nothing is life-threatening or life. I don't say it is not danger, but it is not right to accept it right in the beginning. It is to fight the disease is the first thing. Autoimmune diseases can never be cured. It is the point which is incepted in the mind of the patient before the treatment starts. Be prepared that autoimmune diseases will be there lifelong. Nothing is lifelong. As if it is lifelong, it should be there from the beginning, from the time when we are born. But it didn't happen. It happened suddenly. Something triggered which led to this. So our view is to make the patient understand and prepare the patient to heal himself. Only the one who can heal himself can heal. Then only we can only support that patient. We cannot heal him completely if he is resistant to the healing. So that is very important factor which we deal with. Now let us go with the treatment.